Welcome. Today, we're diving into the world of strep throat, a common infection that affects millions each year. Strep throat is known for its sudden onset of sore throat, pain when swallowing, and sometimes fever. But what actually triggers this uncomfortable condition? In this video, we'll explore the most common causes and risk factors, helping you understand how strep throat spreads and what you can do to protect yourself and your loved ones. Let's start by understanding what strep throat really is and why it's so prevalent, especially among children and young adults. Strep throat is an infection caused by a specific type of bacteria called Streptococcus pyogenes, also known as Group A Streptococcus. This bacterium targets the throat and tonsils, leading to inflammation and discomfort. Unlike viral sore throats, strep throat requires antibiotic treatment to prevent complications. Understanding the bacterial nature of strep throat is crucial, as it shapes how the disease is transmitted and what triggers outbreaks. Next, let's look at how this bacterium spreads from person to person. The most common trigger for strep throat is direct person-to-person transmission. When an infected person coughs or sneezes, tiny droplets containing the bacteria are released into the air. If someone nearby inhales these droplets or touches a contaminated surface and then touches their mouth or nose, they can become infected. This is why strep throat often spreads rapidly in close contact environments like schools, households, and daycare centers. Practicing good hygiene is key to reducing the risk of transmission. Airborne droplets are a major route for strep throat transmission. When someone with strep throat talks, coughs, or sneezes, microscopic droplets containing the bacteria can linger in the air or settle on surfaces. These droplets can be inhaled by others or picked up from objects like doorknobs, toys, or utensils. This is why outbreaks are common in crowded or poorly ventilated spaces. Regular cleaning and proper ventilation can help minimize the risk of airborne transmission. Another common trigger is touching objects or surfaces contaminated with the bacteria. Items like shared toys, phones, doorknobs, and utensils can harbor Streptococcus pyogenes for a short period. If you touch these objects and then touch your mouth, nose, or eyes, you can introduce the bacteria into your body. This is especially relevant in environments where many people interact with shared items, such as classrooms and offices. Frequent hand washing is an effective way to reduce this risk. Crowded environments are hotspots for strep throat outbreaks. Places like schools, daycare centers, dormitories, and offices bring many people into close contact, making it easier for the bacteria to spread. In these settings, one infected individual can quickly transmit the bacteria to others through shared air and surfaces. This is why strep throat is more common during the school year and in places where people gather indoors for extended periods. Strep throat tends to be more common in late fall, winter, and early spring. During these seasons, people spend more time indoors, increasing close contact and the likelihood of transmission. Additionally, dry indoor air can irritate the throat, making it more susceptible to infection. Understanding these seasonal patterns can help you stay vigilant and take preventive measures during peak times. Children and teenagers are especially prone to strep throat. Their immune systems are still developing, and they often spend time in group settings like schools and playgrounds. This frequent close contact increases their risk of exposure. While adults can also get strep throat, it's less common. Parents and caregivers should be particularly cautious during outbreaks to prevent the spread among young family members. Individuals with weakened immune systems are more susceptible to strep throat. This includes people with chronic illnesses, those undergoing certain medical treatments, or anyone experiencing high levels of stress. A compromised immune system makes it harder for the body to fight off infections, allowing the bacteria to take hold more easily. Maintaining a healthy lifestyle and managing stress can help support your immune defenses. Poor hygiene is a significant trigger for the spread of strep throat. Not washing hands regularly, sharing personal items, or neglecting to cover your mouth when coughing or sneezing can all contribute to the transmission of bacteria. Teaching children proper hygiene habits and setting a good example at home and in public spaces can greatly reduce the risk of infection. Sharing food, drinks, or eating utensils can easily spread the bacteria responsible for strep throat. Even a small amount of saliva can contain enough bacteria to infect another person. This is particularly common among children, who may not always be aware of the risks. Encouraging everyone to use their own cups, bottles, and utensils is a simple but effective preventive measure. Being in close contact with someone who has strep throat significantly increases your risk of infection. This is especially true for family members, classmates, or coworkers who spend extended periods together. The bacteria can spread quickly in these settings, so it's important to be cautious if someone around you is diagnosed with strep throat. Isolating the infected person and practicing good hygiene can help prevent further spread. If someone with strep throat does not complete their full course of antibiotics, they may remain contagious and can trigger new infections in others. Incomplete treatment can also lead to complications and antibiotic resistance. It's crucial to follow your healthcare provider's instructions and finish all prescribed medication, even if symptoms improve before the course is complete. Traveling, especially to areas with high rates of strep throat, can increase your risk of exposure. Airports, public transportation, and hotels are environments where many people from different places come into contact, raising the chances of encountering the bacteria. Taking precautions like washing hands frequently and avoiding close contact with sick individuals can help reduce your risk while traveling. Certain environmental factors can make it easier for strep throat to spread. Poor ventilation, high humidity, and crowded living conditions all contribute to the persistence and transmission of bacteria. Improving air circulation, using air purifiers, and reducing overcrowding can help create a healthier environment and lower the risk of infection. People with active symptoms of strep throat, such as coughing, sneezing, and runny nose, are more likely to spread the bacteria. The more severe the symptoms, the higher the risk of transmission. Recognizing symptoms early and seeking medical attention can help contain the spread and prevent outbreaks in communities. Some people can carry the streptococcus pyogenes bacteria in their throat without showing any symptoms. These carriers can still spread the bacteria to others, especially in close contact settings. Identifying and managing carriers is challenging, but awareness of this possibility helps explain why strep throat can sometimes appear unexpectedly in a group. While rare, pets can sometimes carry and transmit streptococcus pyogenes. However, this is not a common route of infection for humans. Most cases of strep throat are spread between people, but it's still wise to maintain good hygiene when handling pets, especially if someone in the household is sick. Living in shared spaces such as dormitories, military barracks, or shelters increases the risk of strep throat outbreaks. Close quarters and shared facilities make it easier for the bacteria to spread quickly among residents. Regular cleaning and encouraging sick individuals to isolate can help control outbreaks in these environments. Using public transportation exposes you to many people in a confined space, increasing the risk of encountering someone with strep throat. Surfaces like handrails, seats, and ticket machines can harbor bacteria. Practicing good hand hygiene and avoiding touching your face while commuting can help reduce your risk. Hospitals and clinics are places where people with various infections, including strep throat, gather. Healthcare workers and patients are at higher risk due to frequent exposure. Strict infection control measures, such as wearing masks and regular disinfection, are essential to prevent the spread of strep throat in these settings. Schools are common sites for strep throat outbreaks due to the close proximity of students and frequent sharing of materials. Teachers and staff can also be affected. Quick identification of cases and temporary exclusion of sick students can help limit the spread within schools. Daycare centers are another high-risk environment for strep throat transmission. Young children often play closely together and may not practice good hygiene. Staff should encourage regular hand washing and sanitize toys and surfaces frequently to minimize outbreaks. Within households, strep throat can spread quickly among family members. Shared bathrooms, towels, and utensils can facilitate transmission. Isolating the sick person, using separate items, and disinfecting surfaces can help contain the infection at home. Participating in sports teams or group activities can increase the risk of strep throat, especially when equipment, water bottles, or locker rooms are shared. Close physical contact and heavy breathing during exercise can also facilitate transmission. Teams should encourage personal equipment use and good hygiene practices. Large community gatherings, such as parties, religious services, or concerts, bring many people together in close quarters. These events can become hotspots for strep throat outbreaks, especially if someone attends while contagious. Organizers should promote hand hygiene and encourage sick individuals to stay home. A poor diet and lack of essential nutrients can weaken the immune system, making it easier for strep throat to take hold. Eating a balanced diet rich in vitamins and minerals supports your body's natural defenses and helps prevent infections. Certain medical conditions, such as diabetes or autoimmune diseases, can increase susceptibility to strep throat. These conditions may impair the immune system's ability to fight off infections, making it important for affected individuals to take extra precautions during outbreaks. Smoking and exposure to secondhand smoke can irritate the throat and weaken the body's defenses, making it easier for strep bacteria to cause infection. Avoiding tobacco products and maintaining a smoke-free environment can help reduce the risk of strep throat. Allergies and environmental irritants can cause throat inflammation, making it more susceptible to bacterial infections like strep throat. Managing allergies and avoiding known irritants can help keep your throat healthy and less prone to infection. Not getting enough sleep can weaken your immune system, making you more vulnerable to infections like strep throat. Prioritizing good sleep hygiene and ensuring adequate rest each night supports your body's ability to fight off bacteria. High levels of stress can suppress the immune system, making it easier for strep bacteria to cause infection. Managing stress through relaxation techniques, exercise, and healthy routines can help keep your immune system strong and resilient. Poor air quality, whether due to pollution, dust, or mold, can irritate the throat and respiratory tract. This irritation can make it easier for bacteria to invade and cause strep throat. Using air purifiers and maintaining clean indoor environments can help protect your throat. Failing to cover your mouth when coughing or sneezing allows bacteria to spread freely in the air, increasing the risk of infecting others. Using tissues or the inside of your elbow can help contain droplets and prevent transmission. Neglecting to clean and disinfect frequently touched surfaces can allow strep bacteria to linger and spread. Regular cleaning of doorknobs, light switches, and shared items is essential, especially during outbreaks or when someone in the household is sick. After recovering from strep throat, it's important to replace your toothbrush. The bacteria can survive on toothbrush bristles and potentially cause reinfection. Make it a habit to get a new toothbrush after any throat infection. Overuse or misuse of antibiotics can lead to antibiotic-resistant strains of Streptococcus pyogenes. These strains are harder to treat and can trigger more severe outbreaks. Always use antibiotics as prescribed and avoid unnecessary use to help prevent resistance. Some people may be genetically predisposed to frequent strep throat infections. Family history and genetic factors can influence how the immune system responds to the bacteria. If strep throat is common in your family, be extra vigilant about prevention. Currently, there is no vaccine available to prevent strep throat. This means that other preventive measures, such as hygiene and avoiding close contact with sick individuals, are especially important. Research is ongoing, but for now, awareness and good habits are our best defense. To summarize, the most common triggers for strep throat include close contact with infected individuals, poor hygiene, crowded environments, and weakened immune systems. Environmental factors, lifestyle habits, and underlying health conditions also play a role. By understanding these triggers, you can take proactive steps to protect yourself and those around you. Preventing strep throat starts with good hygiene. Wash your hands regularly, avoid sharing personal items, and cover your mouth when coughing or sneezing. Stay home if you're sick, and encourage others to do the same. Clean and disinfect, frequently touch surfaces, and maintain a healthy lifestyle to support your immune system. If you experience a sudden, severe sore throat, especially with fever, difficulty swallowing, or swollen glands, it's important to see a healthcare provider. Early diagnosis and treatment can prevent complications and reduce the risk of spreading the infection to others. Strep throat is typically treated with antibiotics, which help eliminate the bacteria and reduce the risk of complications. Completing the full course of medication is essential even if you start feeling better. Supportive care, such as rest, fluids, and pain relievers, can also help manage symptoms. With prompt treatment and good hygiene, most people recover from strep throat without complications. However, untreated or recurrent infections can lead to more serious health issues. Staying informed and practicing prevention are the best ways to maintain long-term throat health. In conclusion, strep throat is a common but preventable infection. By understanding its triggers, such as close contact, poor hygiene, and weakened immunity, you can take steps to protect yourself and your community. Remember, good habits and timely medical care are your best defenses against strep throat. Stay healthy and informed.